What is the initial dose of defibrillation in adults? When using the biphasic defibrillator, 120 to 200 joules is given as the initial dose of defibrillation. When using the monophasic defibrillator, 360 joules is used as the initial dose of defibrillation. What is ventilator-associated pneumonia, VAP? A lung infection that develops 48 hours or more after intubation, caused by bacterial colonization due to prolonged mechanical ventilation. What are the infection control practices in the ICU? Hand hygiene before and after patient contact. Use of personal protective equipment, PPE. Proper disposal of biomedical waste. Daily cleaning and disinfection of surfaces and equipment. What is the first step if the chest does not rise during rescue breaths in CPR? Reposition the head using the head tilt chin lift method. Ensure the airway is open. Check for any visible obstruction in the mouth. Try giving rescue breaths again while observing for chest rise. What is the purpose of the head tilt chin lift in CPR? It opens the airway by lifting the tongue off the back of the throat. This helps ensure unobstructed airflow during rescue breaths. What is the purpose of oral suctioning? To remove saliva, mucus or vomit from the mouth and throat. Prevents aspiration and maintains a clear airway. What is a central line associated bloodstream infection? CLABSI. CLABSI is a serious infection occurring when bacteria enter the bloodstream through a central venous catheter. It is preventable with proper hygiene and sterile techniques, associated with prolonged hospital stay and higher cost of treatment. What are the steps to manage a patient with chest pain? Assess airway, breathing and circulation. Administer oxygen if oxygen saturation is below 94%. Monitor vitals and attach ECG leads. Administer prescribed medications. Example aspirin nitrates. Inform the doctor immediately and prepare for advanced cardiac care. What are the three components of GCS? GCS stands for Glasgow Coma Scale. The three components of GCS are eye opening E 1 to 4 points, verbal response V 1 to 5 points, motor response M 1 to 6 points. What is the function of a defibrillator? It delivers an electrical shock to the heart, helps restore normal rhythm in life-threatening arrhythmias. What is the nurse's responsibility during defibrillation? Ensure no one is touching the patient. Shout clear before delivering shock. Resume chest compressions immediately after shock. What is FAST in stroke assessment? F for face. Ask the person to smile. Check for drooping. A for arms. Ask the person to raise both arms. Check for weakness. S for speech. Ask the person to speak. Check for slurring. T for time. If any sign is positive, take the person to the hospital immediately. What are the safety checks before blood transfusion? Verify patient identity and blood bag label. Check blood group compatibility. Inspect blood bag for expiry date, clots or discoloration. Monitor vitals before, during and after transfusion. What are the complications of inserting a Foley catheter? Urinary tract infection, UTI, urethral injury, hematuria, catheter blockage or leakage, bladder spasms. What are the signs of anaphylaxis? Sudden difficulty breathing, swelling of lips, tongue or throat, severe drop in blood pressure, rash or hives, rapid weak pulse. What are the contraindications for inserting a Ryle's tube? Facial or skull fractures, esophageal varices or strictures, recent nasal surgery, severe coagulopathy. What is the significance of checking for flashback while inserting IV cannula? Checking for flashback confirms that the cannula has entered the vein. It indicates correct placement before advancing the catheter. What are the signs and symptoms of diabetic ketoacidosis (DKA)? Fruity scented breath, rapid breathing, Kusumal respiration, nausea and vomiting, abdominal pain, confusion or altered mental status, high blood glucose levels, ketones in urine or blood. What is the purpose of incentive spirometry? Prevents lung complications such as atelectasis, encourages deep breathing after surgery, improves lung expansion and oxygenation, helps in clearing secretions. How to manage a patient on magnesium sulfate therapy? Monitor deep tendon reflexes. Check urine output, which should be more than 30 ml per hour. Monitor respiratory rate, which should be more than 12 breaths per minute. Keep calcium gluconate at bedside as antidote. What is the significance of GCS score less than 8? Indicates severe head injury and poor consciousness level. Often requires airway protection and intensive monitoring. What is a pressure ulcer and how do you prevent it? It is a localized injury to the skin and underlying tissue due to prolonged pressure. Prevention includes frequent repositioning, use of pressure relieving devices, good nutrition and hydration, maintaining skin hygiene. What is the difference between asepsis and antisepsis? Asepsis is the prevention of infection by maintaining sterile environment. Antisepsis is the use of chemical agents to destroy or inhibit microorganisms on living tissues.